Crash course on health sciences, epidemiology and public health. Explore the study of disease and its spread, as well as public health interventions and policies. Epidemiology and public health are essential fields in the study and prevention of diseases. Epidemiology is the study of the distribution and determinants of health-related states or events in a population, while public health involves promoting and protecting the health of communities and populations through various interventions and policies. In this crash course, we will explore some interesting examples and stories, list the top 12 large epidemiology events impacting public health, and summarize these topics. One interesting example of epidemiology and public health is the study of the 1918 flu pandemic, which was one of the deadliest pandemics in history, infecting an estimated 500 million people worldwide and causing 50 million deaths. The pandemic was caused by the H1N1 influenza virus, and it had a high mortality rate among young adults. The epidemiological study of the pandemic helped to inform future public health policies and interventions to prevent and control the spread of infectious diseases. Another example is the study of HIV/AIDS, which has been a major public health concern since the 1980s. Epidemiological research has helped to identify risk factors for HIV transmission and develop effective prevention strategies, such as the use of antiretroviral therapy and pre-exposure prophylaxis, PrEP. Now, let's take a look at the top 12 large epidemiology events that have impacted public health. 1. The Black Death. The bubonic plague, also known as the Black Death, swept through Europe in the 14th century, causing the deaths of an estimated 75 to 200 million people. This devastating event helped to inform early public health measures, such as quarantine and sanitation practices. 2. Smallpox eradication. Smallpox was a highly contagious and deadly viral disease that killed an estimated 300 to 500 million people in the 20th century alone. The development of a vaccine and widespread vaccination campaigns led to the eradication of smallpox in 1980, making it the first disease to be eradicated by human effort. 3. Spanish flu pandemic. The 1918 flu pandemic, also known as the Spanish flu, was one of the deadliest pandemics in history, infecting an estimated 500 million people worldwide and causing 50 million deaths. 4. Tobacco epidemic. Tobacco use is a major public health concern, causing an estimated 8 million deaths worldwide each year. Epidemiological research has helped to inform anti-smoking policies and interventions, such as increased taxes and smoking bans. 5. HIV/AIDS epidemic. The HIV/AIDS epidemic has had a significant impact on public health since it was first identified in the 1980s. Epidemiological research has helped to identify risk factors for transmission and develop effective prevention strategies, such as antiretroviral therapy and PrEP. 6. Cholera outbreaks. Cholera is an acute diarrheal disease caused by ingestion of contaminated food or water. Cholera outbreaks have occurred throughout history and continue to be a public health concern in some parts of the world. 7. SARS outbreak. Severe acute respiratory syndrome, SARS, is a viral respiratory illness that caused a global outbreak in 2003, infecting over 8,000 people and causing over 700 deaths. The outbreak helped to inform public health policies and interventions for controlling the spread of infectious diseases. 8. Swine flu pandemic. The H1N1 influenza virus, also known as swine flu, caused a global pandemic in 2009-2010. The pandemic led to increased efforts to develop effective vaccines and public health interventions to prevent and control the spread of influenza. 9. Ebola outbreak. The Ebola virus is a highly contagious and deadly viral disease that has caused several outbreaks in Africa since its discovery in 1976. The outbreaks have led to increased efforts to develop effective vaccines and treatments for Ebola, as well as increased awareness and preparedness for future outbreaks. 10. COVID-19 pandemic. The COVID-19 pandemic, caused by the SARS-CoV-2 virus, has had a significant impact on global public health since its emergence in 2019. The pandemic has led to widespread illness and death, as well as economic and social disruption. Epidemiological research has been crucial in understanding the transmission and impact of the virus and informing public health interventions, such as vaccination campaigns and social distancing measures. 11 Zika virus outbreak. The Zika virus is a mosquito-borne virus that caused a large outbreak in the Americas in 2015-2016. The outbreak was associated with an increased risk of birth defects, such as microcephaly. Epidemiological research helped to identify the link between Zika virus infection and birth defects and inform public health interventions, such as mosquito control measures and education on preventing infection during pregnancy. 12 Polio eradication. Polio is a viral disease that can cause paralysis and death. The development of a vaccine and widespread vaccination campaigns led to the near eradication of polio, with only a few countries still reporting cases. In summary, epidemiology and public health are crucial fields in the study and prevention of diseases. From the bubonic plague to the COVID-19 pandemic, large epidemiological events have had a significant impact on public health throughout history. Epidemiological research has helped to identify risk factors for disease transmission and develop effective prevention and control strategies, including vaccination campaigns, quarantine measures, and public health policies. By studying and understanding the distribution and determinants of diseases in populations, we can work towards improving the health and well-being of communities around the world. And now, as requested, here is a poem about epidemiology and public health. Epidemiology and public health. The study of disease and its stealth. From the Black Death to COVID-19. Epidemiologists have seen it all, and then some. Smallpox eradication, a major feat. With vaccination campaigns, the virus did retreat. Tobacco use, a public health blight. Epidemiology shed a clear light. HIV, AIDS, a scourge of our time. Epidemiological research helped to define. Cholera outbreaks, a cause for concern. Sanitation and clean water, a lesson to learn. SARS and swine flu, pandemics in sight. Epidemiology helped to shed light. Ebola and Zika, a global fright. Epidemiology helped to make things right. Polio near eradication, a reason to cheer. Thanks to epidemiology, we are almost there. Epidemiology and public health, a vital field. Protecting our communities, our health, our shield. Start planning your next global adventure with ease and convenience with our Booking.com referral link. https://www.booking.com/index.html?aid equals 7989335 as a great choice to plan your next trip. You can find and book flights, hotels, cars, and local attractions all in one place, and their price match guarantee ensures you're getting the best deal. Thank you for kind support our AnHub Metaverse channel, and please watch more interesting videos here.